Hello, community. Naomi Anderson here from Aged Care Ready and founder of the Aging Parent Support Group on Facebook, which is where you're seeing us tonight. Welcome to episode 10. Thank you for joining us. Tonight, we are joined by Jacquie Bigger from Senior Dental Care in Sydney. Welcome, Jacquie.
Thank you. Thank you for having me along.
Tell us a little bit about yourself and Senior Dental Care.
So, as you said, my name is Jacquie. I live in Sydney and I'm an oral health therapist and the founder of Senior Dental Care. I'm a clinician and a practice manager in a private practice in Sydney. And I've also been a clinical educator for the University of Sydney for a number of years now, teaching the final year students their clinical work. Senior Dental Care is a mobile dental business. My business partner, Dr. Aegis, and I created that focuses on preventative dental care mainly to treat and preserve the mouth for as long as possible. We can either work alongside a dentist that already is instilled in a dental practice, or we can provide one if one isn't there, but our main focus is prevention and hygienist work.
Sure.
We start focusing on we're starting to focus on educating patients, patients' families and staff members in facilities around oral care. And we're trying to achieve better dental health for the community.
Nice. So what you do is actually go out to people's homes and facilities?
Yes, yeah. So we're more of a mobile dental clinic to go out to people's homes or to aged care facilities to provide the prevention.
Sure. Sounds like a really much needed service.
Yeah, definitely. There's definitely a gap there. And, when you start a business, everybody says you need to know the what, when, how and why. And to be honest, I didn't really know the what, when and how, but my why was to fill the gap, to bridge the gap between the accessibility of dental prevention and the aged care, but also to bridge the gap between professional oral attention and invasive dental treatment, which lots of people see.
Yeah, okay. Before we get kicking off into the main questions, for those of you who are watching this live, feel free to post any questions that you have in the comment section below. I am watching, and we will answer them as we go. So let's get started. Jacquie, what is the biggest thing that most elderly people overlook in terms of oral health?
Well, I think the biggest thing is the big picture. It's not only, good oral health is not only about brushing or having strong teeth. The mouth is really closely linked to the rest of the body, and everything that passes our lips affects the oral cavity as much as affects the body as well. So a good example of that is the medications that we take. As we age, we may acquire some certain conditions that also require medications, and the medications can also have, a profound effect on the body in an adverse way, as well as the oral cavity. So, I think that's the biggest thing that's being overlooked in aged care or being an elderly person at the moment. I think the elderly, as a cohort generally today, general society, and even sometimes in the literature, they've separated the mouth from the body for a long time. And, medical GPs and specialists, they look after the body, and dentists look after the teeth. But, the whole medical profession, and I'm going to include oral health professionals in that, they really come to agree that they're strongly connected. And it's important to realise that now. Yeah.
So essentially what you're saying, it's the gateway to the rest of the body.
Well, yeah, essentially. And I think Dr. Zankert touched on it briefly in his Facebook Live in episode 5. It's not only about the condition or the age of the person, but it's about treating them as a whole.
Yeah, absolutely. So with that being said, what is the biggest issue that you see with the elderly? What's the biggest problem, I guess, that you come across?
I think mainly dry mouth or xerostomia is what we call it. I believe it's the one thing that we see and the biggest thing that we see because it has so many flow-on effects when disruption of the saliva quality or quantity, it can, affect a lot of things in the oral health and lead on to other diseases in the mouth. Saliva is like liquid gold. We don't really know what we've got until it's gone. Sort of, dental health wise, as well as, being comfortable and symptomatic. So, it's not only the first stage of digestion, it helps with keeping the mouth comfortable, it aids with oral clearance and the natural bathing of the mouth, and importantly, can balance out the pH in the mouth, which is really important as well. Yeah. Without it, all of us, no matter how old we are at extreme high risk for oral disease.
As an RN working in the aged care space, I know that there are additives and things that we can do for an elderly person who does suffer from this. Can you talk a little bit about the products that are available for that?
Yeah, well, I think the main thing is for us as dental professionals is to find out why the patient has a dry mouth. When we find out why, using our diagnostic sieve, we can figure out the most appropriate treatment. So yes, there are definitely products out there that can help with dry mouth, the symptoms of dry mouth, and that can in turn affect or have a positive effect on the teeth and also the risk of disease. So there are lots of different brands out there for oral health saliva substitutes. The one I like to think of and the one I'll recommend is called Oral 7. So, Oral 7 is a brand of dry mouth products, and it comes in a gel, a spray, an atomizer, a toothpaste, a mouth rinse, that kind of thing. So determining on why the patient will need dry mouth products can lead us in the right direction of which one to choose. But certainly there are a lot out there to help reduce the risk of oral disease using the products like that.
Yeah. So what are some of the most common reasons for dry mouth?
It can be a number of reasons. Unfortunately, as we age, things get in the way of our general health, and a saliva can be one of those. Lots of things that can impact our saliva flow are things like medications. So being on multiple medications or polypharmacy, or being on certain medications treating certain diseases can also affect. Other things such as radiation to the head and neck can reduce our salivary flow quite a lot, and nutrition, inability to metabolize medications, diabetes can affect the saliva flow. Lots of chronic conditions and their medications usually are the main culprits.
Okay.
So these things affect the majority of the elderly cohort, I think.
Yeah, and I imagine dehydration would play a part in that as well.
Absolutely. Yeah.
Okay. Our next topic, dental pain is something that is seen in the elderly. What is the best thing that we can do as we age to prevent complications in later life?
So probably it's the answer that you're already thinking of. Good oral hygiene at home, obviously, brushing twice a day, flossing, keeping our gums and teeth nice and healthy, but also seeing your dental professional once or twice a year at least. So prevention is the key to this. Preventing complications later in life, you need to act now with your oral health and your general health as well. I mean, like we say, it's all linked, but sometimes I explain it to my patients like, sort of think of your mouth like, a brand new Ferrari or a very expensive car. You need to put time in it. You need to have it serviced. And, if you do have it serviced regularly, then everything will be in kept good working condition. But if you don't, parts can wear out, parts will wear down, they can break, and then you're out of pocket a lot of money and a lot of time. So, in saying that, prevention is not only about seeing your oral health therapist, but having good nutrition, like we spoke about before, keeping healthy physically and mentally, good nutrition, drinking enough water, and that kind of thing.
Okay. And just on a little bit of a side tangent, sorry, things like dental implants and things like that, how does that affect the elderly later down in down the track? Say if they had implants done in their 60s or 70s, how does that affect them in their 90s?
Well, we say, we can treat an implant at home just as we would treat a natural tooth. So with good oral hygiene and keeping that bacterial load and plaque under control, then an implant really shouldn't act any differently to a natural tooth. Lots of people nowadays are spending a lot of money on your teeth. That's why the Ferrari analogy comes into play. But lots of people are spending money on their teeth, and they are going to facilities, or they are acquiring these, chronic conditions later in life that they can complicate things. But your general oral health and your basics can really help prevent further complications, dental infections, and that kind of thing. So yeah, implants are definitely a concern, and they probably will be more of a concern at moving forward because more of us are seeing it. Well, more of us are knowing that it's now a gold standard of tooth replacement. So lots of people are getting them, and they will get old with them, and we still need to keep up our good oral health to keep them healthy too.
Yeah. Okay. And for those viewers in our community group at home caring for elderly parents, possibly, some who may have dementia, what is the best way to assist them with their oral hygiene?
Well, this was a difficult one because, I can only imagine the list of things that these people have to do caring for their loved ones with dementia at home. I'm sure, my tips and tricks would be similar to those of other personal hygiene care, but, I hope I can contribute in some way. But I think, first of all, it's to sort of be able to recognise signs of oral problems. If your loved one stops eating or stops eating specific things that they would usually enjoy, pulling at the face or mouth, not wanting to put their dentures in or taking their dentures out constantly, interrupted sleep patterns, things like that, increased aggression, all of those things can lead to a sign of oral health pain. It's just using that diagnostic sieve of trying to figure out what the problem is and where it's coming from. So other tips that you can do are, depending on the sort of stage of the dementia, you can leave a note on the fridge, you can leave their toothpaste or toothbrush out on the sink, give them a call and remind them, or, doing the task together, then be able to watch you brush, the technique you use and the movement involved, and even the time you take to doing it. So
like a mimicking.
Yeah, exactly. I think it's always important to encourage them, put a positive spin on it, say things like, my mouth feels so fresh after I brush my teeth. I like the way my teeth feel when they're clean, that kind of thing. But unfortunately, persistence is the key with this one, and that's the tough thing. Any time is a good time to brush. So that's what I want sort of the take-home message to be. Nighttime brushing is very important and is very much ideal. But any time during the day is a good time to brush. You're still removing the plaque. You're still reducing the bacterial load, reducing the risk of disease. So if they want to brush before lunch, don't say no.
Yeah.
In the advanced stages, physically brushing the teeth might be hard. If it's painful for them, try to find out why. Do they not like the vibration of the electric toothbrush? Do they not like the person trying to brush their teeth? Find out why. But if you still can't get the brush in there and you still find it really difficult, you can sort of think outside the square. So if they have a lot of sugar in their diet or sugar in their tea, ask them to drink a sip of water afterwards. Have that oral flush and the oral clearance of the sugary products. Try to avoid sticky sugary foods that will hang around in the mouth if you know that they're not going to brush that day. You can encourage a fluoride mouth rinse if they're not going to brush that day. You can try changing different toothpastes, the textures, the flavors, all of that kind of stuff might change, or just switch so they can get the task done.
Yeah. You touched on the electric toothbrush before. Would you recommend that over a manual toothbrush?
It's hard because in this situation, probably yes, because I think that it gets a little bit more of the job done effectively for the time that you'll probably be in the mouth. In saying that, a manual brush can still do the same job if you're using it with the right technique, in the right timing, and, doing it properly. So they both can do the same job, but if you're using a different technique, then, the electric brush can be a little bit easier.
Yeah. Okay. No worries.
Yeah, if it's tolerated.
And for those who have dentures, what is the best way to clean and store them?
Yeah. Okay. So just like we were talking before with the implants, dentures are definitely still around, but lots of the time now they're partial dentures. They're not full dentures. So we're sort of having a mixture of natural teeth as well as dentures. So we try to look after them the same way we would look after natural teeth, except we take them out at night.
Yeah.
So we try to brush them once or twice a day on all surfaces. Including the palate, importantly the palate, and also the parts that you don't see in the mouth. I tell my patients to focus on the gum line when they're brushing their dentures, and it's similar sort of technique to how you brush your natural teeth, but I find that with dentures the staining accumulates along the gum line. There can be some food impaction or food getting caught up in near the gum line because of the curvature of the denture and the way the acrylic bends. So if you focus around the gum line and the palate, but all sides of the denture need a good brush. So another tip for brushing dentures is line the bathroom sink with a thin towel or a face washer, and put the water on running slowly and on cold. So this way, if you drop it, it doesn't break. It's a very common and expensive mistake.
Happens all the time.
Yeah. So, if you have a towel lining the bathroom sink, that can be a good way to prevent the breakages. Using a denture brush is also really important. You can use a normal toothbrush, but you should have a separate brush to brush your dentures. The bristles on a denture brush are usually quite or a little bit more stiff. They're tapered, and so you can get into all the nooks and crannies and the clasps and that kind of thing. You can use your leftover toothpaste from your toothbrush, or you can just use normal soap and water.
Okay.
Yeah. It's vital that we leave our dentures out at night time. This, I guess, is primarily to allow the tissues to breathe, to have that self-cleansing action. If we leave them in 100% of the time, our palate and our soft tissues can become quite aggravated and inflamed. And this is a really common condition that we see in the elderly. We call it denture stomatitis. And it can lead to quite aggressive sort of infection, and it can become quite painful. And then in turn sort of affecting the patient's eating ability and communication.
Yeah. And to be honest, if I had to leave dentures in overnight, I'd be quite frightened that I would swallow them and possibly choke. And I know that sounds really stupid, but that's something that I would probably be really fearful of.
Yeah, and it definitely can happen. I'm sure it has happened. And there are lots of people that prefer to keep their dentures in. I mean, I have plenty of patients in private practice that never take their dentures out at nighttime. It doesn't matter what I say, because their husband doesn't even know that it's a denture or they're just too embarrassed. So, it's important to educate them on the reason why we do that, to help avoid those fungal infections and oral candida. Yeah.
And so when you're leaving them out overnight, are you soaking them all night?
So there are different ways of leaving our dentures out at night time. I'm sure people may have heard of cleansing tablets. So popular brands there are Sterident and Polydent. They all have these cleansing tablets, sort of effervescence tablets that we leave in the water. And they're very good at cleaning our dentures. I would recommend to read the instructions for each of those. It's not very much a blanket rule of leaving them in the solution all night long. You can get express clean tablets, so they're a little bit more powerful. So you leave your denture in them for a shorter time. So if you do that, you can leave it in just plain cold water overnight. But certainly a good brush, the physical removing of the plaque is very important, and also to cleanse them no matter what the instructions on the packet say.
Sure.
Yeah.
Sounds good. Have you got anything to add, or community who are watching, have you got any questions? Have you got anything to add there, Jacquie? Anything else that you want to have a chat about?
No, I think I covered everything. I'm more than happy to take this offline if any of your viewers would like to email me or have another conversation about their particular problems. Yeah, I'm more than happy to help whoever needs it.
I see you popping up in the group quite often. So if anyone wants to have a chat with Jacquie, just look up Senior Dental Care. In our community group, she's there. She's floating around. Otherwise, if anybody else has any other questions, feel free to reach out to me or to the page or to Aged Care Ready. Thank you again for joining us tonight, Jacquie.
Thank you.
And
Thank you for having me.
educating us. And have a great night. Good night.
Thank you so much.